Hi, everybody. It's Matthew Dickson of minday.ca. Welcome. It's Wednesday night, and I did something different today. I went for a 44-hour walk, 4 hours and 20 minutes. It's the longest walk I've been on in years. It's, yeah, very happy about that. It's amazing. I read somewhere a runner said that he said when he runs, he feels like he's accomplishing something instead of sitting in his office doing stuff. And I read that years ago, and there's truth to that. There's truth in that and getting the body going, and especially long distance. I bicycled across Canada when I was 20, and I wanted to do more adventures like that. But with mental illness, I just didn't have the energy to. But I will say, in the early years of my recovery with schizophrenia, I could walk. I walked a fair bit. I didn't do like 4-hour walks or anything, but I would be out there walking a fair bit. It was one of the things I could do that brought the pain down a little bit. There are actually 5 things I could do. I could sit there or lie there doing nothing. I could listen to music. I could watch TV. I could read, and I could go for a walk. Those were things that brought the pain down just a little bit. And anyway, I did walk for many years. Later on in my recovery, I wasn't walking as much. I should have been, but not like I was in the early years of my recovery. Covered a fair bit of ground then. But to go, that was the longest walk I've ever done, I think, today. So it's nice. It's nice to be able to do that, to get outside and get the body going. I really enjoy that. There's For those of you who may not have the energy to do that, keep having hope. I spent many years lying in bed, and also remember I was thinking about this today too. If you are having a bad day, and I've had many bad days in my life, and where you're thinking, well, I'm just lying in bed, I can't do anything, or I'm just watching TV, and I wish I had the mental health to do other things like go to a job or whatever, do the things that you uh, would really like to do with your life. Remember that it's a bad day, and there'll be more bad days. Today was a good day for me. That doesn't mean I'll be doing this walk every single day for the rest of my life. I'll have more bad days to come. I'll have more bad days where I'm like, I don't want to get out of bed today. Lots of us have days like that. There are lots of us who aren't mentally ill who want to just stay in bed all day once in a while. It's nice to have just a day to chill and relax. I call them my hammock days. I get days throughout the year where I could easily just sit in a hammock all day and just do nothing. And it's not because I'm mentally ill per se. It's just, I mean, there are days, yes, there are days when I'm lying in bed and I don't feel good, but there are the days when I feel pretty good, but I just don't want to do anything. And those are my hammock days, right? Just happy, peaceful, and just want to chill and relax. I remember seeing an ad for Disney on TV once saying, they show this family having a jam-packed day. Then the next day, they just take it easy. Just a nice, easy day. So remember that when you're mentally ill, maybe if you can't get out of bed some days, maybe that's not because you're mentally ill that day. Maybe that's just a day your body just wants to have a day off, just to chill and re-energize and rejuvenate. Rest is very important. Athletes will tell you that rest is more important than the actual exercise itself. I mean, yes, you have to do the exercise. It has to get done. You can't just rest all year and expect to go to the Olympics. But rest is very important. It's very important. So I wasn't resting today. Well, I rested after my walk, but yeah. One thing that I find I'm doing with mental health in developing countries is when people talk to me, a lot of people are interested or don't know much about schizophrenia. So I can talk for a fair bit about that. But I find in conversations with people, I don't end up talking about the mental health in developing countries part as much as I wish, or as I thought I would. And I'm trying to, I do talk about it briefly, I find, and maybe that's because I've got more experience with my own disease. My experience with mental health in developing countries is about 4 or 5 years now that I've been looking up, researching the cause, and I've got my website minday.ca where you can go and donate to 10 nonprofits. There's 10 now that you can help people with basic mental health care in developing countries. But I'm trying. I should make more of an effort to talk more about that and paint a picture for people of what they can do. And part of it comes down to my own excitement levels. How excited do I get when I talk about mental health in developing countries? It's throughout my disease, my recovery, excitement was something I didn't really feel a whole lot of the time. I felt very more robotic in how I spoke. Affect is something they talk about with schizophrenia, where you're just more blunted emotionally, and I definitely felt like that. And I want to get more excited and animated when I talk about mental health in developing countries. I do that to a certain degree. I just want to ramp it up more and say, like, look, like, there are people suffering horribly, and there's ways to help them. And for my website is the only one of its kind in the world, with all the groups helping mental health in developing countries all on one site. And I'm really trying to promote that more. And when I talk to people about it, I'm reaching out to people online. I don't know how many times I've written the sentence, "Hi, I'm Matthew Dickson. I help people with mental illness in developing countries get access to basic mental health care at my website." I've written that, I don't even know how many times, but I want to keep saying that sentence. That's the bulk of what I do. That's my elevator pitch. And I want to keep saying that more and more and more. I'm hoping by the time I'm 80 or 90, I'll have written that sentence and said it out loud thousands and thousands of times. So here's hoping. So I don't get tired of talking about it. I could talk about it all the time, but I want to talk about it more and more detail. Like, so with Mind Aid, the 10 nonprofits people can donate to or fundraise for. I want to. I mean, some nonprofits, the way they work, like charitywater.org, for example, you can donate money directly to them, and then they send it out to local groups working on the ground in developing countries, and they get them clean water where they live. And so you don't really hear the names of the groups that they work with as much on the ground doing work. And I'm sort of, the way I'm set up, it's a little bit different. I tout the name Mind Aid a lot, and let people know about that. The actual groups doing the work, right now, I'd like people to know more about these names: Strong Minds, Fine Mind, Basic Needs, Try Recovery Global. They do trauma recovery yoga in Iran right now, and it's Partners in Health and CBM UK, Minds Foundation. These names, I'd like to get people knowing more about them. And I'd like to build up, because I want to build up their capacity. I want people donating more to them, because they're the ones doing the work. Maybe someday I'll have my own nonprofit or social business, and I'll hire people, and I'll use these same models of basic mental health care, and go pick a certain country or a number of countries after so many years, and work with locals on the ground getting the mental health care right there. And I'll be the one spearheading all that, or my team will be, and I'll be a part of that. But for right now, I'm steering people towards these groups already doing work on the ground in the field. And I just want to have more people know about their names, because right now, they've got more credibility than me. Right now, basically, it's me and a website and social media, and I'm speaking and letting people know about this. My website does have a unique angle of being the only one of its kind, with all the groups working on the cause on one site, as many as I can find so far. I keep finding more groups as time goes on. But I want me, for the meantime, because I'm not doing any of the physical work myself, I'm just steering people towards these 10 nonprofits doing the actual work on the ground in developing countries. And I want more people knowing, like Strong Minds, how many people have gone on their website and looked up what they do. There's plenty of information on their website. You can donate, fundraise for them. They've got their own fundraiser. And Fine Mind, they're working Uganda. They're relatively new. I'm trying to steer people towards them a fair bit, because I'd like to see them get more of a foundation underneath them. The other groups, the other 10, have been around for longer. Well, Trauma Recovery Global, Try Global, is fairly new too. And I'd like to see those two, Fine Mind and Try Global, get more funding, so they can get more of a foundation. Minds Foundation, they work in India, and Raghu Appasani is the founder. You can go on their website and find out more about what they do. Basic Needs, they've been around for the longest. Basic Needs was made in 2000 by Chris Underhill, and Basic Needs, the head part of basic needs was amalgamated into CBM UK a few years ago or so, but the different branches of basic needs still exist. And the ones you can donate to, not all of them you can donate to on their website, but there's a few of them that you can, and they're a part of the 10 nonprofits on the MindAid website under the donate section. And Basic Needs US, they're in Massachusetts, but they help people across, in developing countries. They have had a pilot program that they put in a rural place in New Mexico, I think, with rural indigenous, and also an urban Detroit setting. And they've had success with that, using these models of basic mental health care there too. Back to Strong Minds, they have a new thing called Strong Minds America, and that was started this year. And they are helping people with these models of basic mental health care in America. And that could be a great resource for people in America who can't afford or don't have the access to mental health care. That could help them. And I'd like to see them get more oomph funding behind them. The other Partners in Health, there's partnersinhealth.org. They're the ones, they're in the States. They also have another branch in Canada, Partners in Health Canada. And you can donate to either one of those two. And they, with CBM UK, which was amalgamated with Basic Needs years ago, like I said, CBM UK and Partners in Health, they do work in developing countries. They do work beyond just mental health. They work like in education and healthcare, like food and whatnot, other humanitarian needs, not just mental health. So if you're wanting to fund money purely for mental health, the other 8 are good ways to go. If you don't mind part of your donation, if you donate to Partners in Health or CBM UK, if you don't mind part of your donation going to things other than mental health, you can donate to them too. You may be able to ask Partners in Health and CBM UK if your money could go straight towards mental health if you donate to them. I haven't asked them that yet, I don't think, but they may be agreeable to that if you phone them and tell them that's what you want to have happen to your money. The other 8, though, it's all mental health, what your money goes to. So there's some big names behind them. Bill Clinton and the band Arcade Fire have promoted Partners in Health. They've endorsed them, and Ashley Judd, the Hollywood actress and singer, she's narrated a promo video for Strong Minds. Fine Mind has Forrest Whitaker, the Star Wars actor. His foundation is working with Fine Mind. There's some big names behind these. So these nonprofits are relatively small. Well, they're small compared to the large humanitarian organizations like UNICEF and whatnot, but they still have, at least $1 million budget, and they're doing great work. They've been helping thousands of people get their mental health back. These models of basic mental health care are low cost, proven effective, and scalable. And the World Health Organization is trying to figure out the best way to roll them out to the masses. In the meantime, these groups are using these models with success. They don't help everybody. Not everybody. These models aren't 100% a cure-all for everybody. Just like our mental health care systems in developed countries they don't help everybody. Some people, but they are very good at what they do. They are the best bang for your buck. They're low cost and they work. And it would be wonderful if more people could fundraise or donate to them, or at least raise awareness about them, sharing posts. Strong Mind has some videos on its YouTube channel. The other the other 10 nonprofits, they have YouTube channels and Facebook pages. You can share their posts and whatnot. That's all free to do if you want to help out. There's a Facebook group at MindAid, and you can join that to meet other people who'd like to help the cause. And I encourage you to join that. There's 70 or so people in there now. This is work that is being done already. This year, there will be thousands of people getting mental health care, basic mental health care from these 10 nonprofits. And next year, there'll be more and more and more and more and more as time goes on. I'd just like to see them go faster and have more money donated to them. So you can donate as little as $3 a month to some of them. I think Strong Minds is maybe $5 a month, the lowest they can go, but you can check that out when you go on their donation pages. You can see, you can just type in a number and see if that works or not. That's how I tried some of them. I tried in 3. If that didn't work, I tried in 4 or 5. and just to see what the minimum donation is, because every little bit helps. And I mean, with Charity Water, they have a program called the Spring where you can become a monthly member. Instead of getting one-time donations, you can become a monthly member and have a certain amount of money coming out of your checking account into their, and that goes to them once a month. And it's wonderful. It's yeah. So if anybody wants to do that, small, well, actually, with Charity Water, a good chunk of their donations come from the Spring, from monthly memberships from people who donate a little bit each month. It's you think $3 a month, $5 a month doesn't matter. Why would I bother? It's not that much. A lot of people are struggling themselves financially. How can I afford that? Maybe you could. Maybe you could, because every little bit helps. If 1,000 people gave $3 a month, that's $3,000 a month. If 10,000 people gave $3 a month, it's $30,000 a month. 100,000, a million people at $3 a month is $3 million. Is this something you can do? Maybe in the future. Maybe for now, just try sharing some posts, raising awareness about this, starting conversations. Tell people about MindAid and where you can go and where they can go for more information. It would mean the world to people. Someone in Africa, for example, right now, who's mentally ill and untreated and has been untreated for years, and they're thinking, please somebody stop this pain, please somebody stop this pain, please somebody stop this pain. And maybe they're in a village that'll be that one of these 10 nonprofits will work in very soon, and your money can go to help them. And to be free of mental illness is a real gift. I've gotten that gift. I've been freed from mental illness. I have my own brain back again. It's wonderful to think my own thoughts, to have my own feelings, and I'm stronger because of it. And it's a wonderful, wonderful place to be, just to have sanity, pure, just sanity. Sobriety, you could call it that. I never had a problem with addiction, but sobriety I can relate to. A lot of in the latter part of my recovery, for about 30 years or so, I felt just thinking sober. Oh, it's nice to feel more sober instead of just amped up and not thinking as clearly as you'd like. It's a real gift to get that. So if any of you are struggling, I know you may be thinking, I'd love to help you, Matthew, but I've got my own recovery to look after. And for that, I want to say, good for you. Your recovery is an amazing accomplishment. And if the best you can do today is look after yourself, that is amazing. That is absolutely amazing. Helping other people is the icing on the cake. And for those of us who are able-bodied and can do more stuff to help other people, that's what we're supposed to do. It'd be wonderful if we can. Basically, it's wonderful to help other people. If you're struggling with your own mental health, it's an amazing accomplishment. You deserve medals. There should be medals pinned to your chest today in a ceremony from your country's leader, saying congratulations for your bravery, your courage, your determination to fight through another day. It's phenomenal what you did today. And I don't want you to forget that. I know your brain will probably tell you, I'm just doing this, I'm just doing that. My brain told me that for years. But I want at least someone to say, maybe I'm the only person saying that to you, but I want to say that to you. I know I don't know you, but I just want to say it. Congratulations. Keep fighting. Thank you for what you did today. It's phenomenal. Your life is priceless. So I'll just leave it on that, and have a good night, and I'll see you Friday.